year's Mental Health Day theme talks about making mental health and well-being a global priority. It resonates with the World Mental Health Report released recently on 17 June 2022, which says that mental health conditions are highly prevalent in all countries. About 1 in 8 people in the world live with a mental disorder. Anxiety disorders and depressive disorders are the most common among both men and women. The report also says that mental health exists on a complex continuum, with experiences ranging from an optimal state of well-being to debilitating states of great suffering and emotional pain. Hello, I'm Dhwani Shetty, a psychology student, and I'm currently interning under Dr. Sheba Singh, a psychologist at her clinic, TalkSpace, a mental health studio. The aim and mission of TalkSpace is to help people with several mental health difficulties to get better and lead a healthy life. Moreover, it is a platform that would nurture and contribute to quality and accessible mental health, including inspiring and grooming young and budding mental practitioners in learning and experiencing through real case studies. When it comes to mental health, there is still a lot of stigma attached, due to which people prioritize illness over health. Hence, to break the stigma and to spread awareness, we at TalkSpace are talking to experts in the field of mental health. And here we are with the first in our series. We have with us Dr. Sheryl John Senthilnathan. Dr. Sheryl is an eminent psychiatrist, born and raised in Mumbai. A celebrated speaker on mental health, she has a thriving psychiatry practice as she consults at Dr. L.H. Hirandani Hospital, Powai, and Holy Spirit Hospital, Andheri East. We are here to discuss and spread awareness about the most common mental health disorders, which are anxiety and depression. Welcome to our show, ma'am. We're honored to have you here. So, beginning with a very basic question, how does a person with anxiety disorder look like?
Thank you first and foremost for having me here, and a great initiative to create awareness. So I think the first question about anxiety is very, very important, because we see a lot of patients with anxiety and they can have two kinds of presentation, right? One is the most obvious kind, where they're coming with a lot of physical symptoms. They look restless when they're sitting in the OPD, they're fidgety, they're pacing around before their appointment. When they come in, they start with a lot of information and take a long time to actually come to the problem. And a number of patients also come with expressing only the physical symptoms of anxiety. We have certain individuals who do not talk about anxiety at all because they are functioning otherwise well. But when we kind of question them and probe them, then it comes about anxiety as worrisome thoughts. So these are few of the presentations of anxiety.
Okay. So now I see you mentioned physical symptoms of anxiety. So can you help us understand how we can be sure if they have a physiological basis and or a psychological basis?
Yeah, so mostly when we talk about anxiety, we have to understand it's the physical basis of anxiety which troubles the patient the most. So I'll try to explain it a little bit. Our brain has kind of two nervous systems. One is the sympathetic nervous system, which is supposed to alert us to danger. And how does it alert us to danger? By going on a fight or a flight response. In a person who is anxious, what happens is the sympathetic nervous system is on overdrive. So they're constantly worried that something is going to go wrong, and that's why the physical symptoms come up. So all the symptoms that will come up if you have to flee from danger, that means your heartbeat is going to increase, you're having palpitations, breathlessness, choking sensation, you can have tingling in your hands and feet, you feel as if your legs are heavy, or before how you feel before an exam, nauseous, wanting to visit the bathroom again and again, stomach cramps. A lot of times they come with significant headache and migraine, or even dizziness. So these are some of the physical symptoms of anxiety.
Yes, ma'am. So, doctor, moving on to the other extreme of the continuum, our viewers would like to know about the signs of extreme anxiety and what can one do in the case of extreme anxiety?
So any of these symptoms that I mentioned before, it's a spectrum, right? It could start with one on-off symptom. You could have headaches sometimes, or you're feeling dizzy. And we see that regularly in the hospital. We ask our patients about history when they come to us, usually with extreme anxiety. They don't come when it's in the the nascent state, because they feel that we can manage this. Thoda to heartbeat increase hua hai, I'm feeling a little dizzy, and give explanation for that. Oh, this was a situation, I had a presentation, that's why I was nervous. They always come when this kind of percolates to all aspects of their life. So even when there is no trigger, there is no presentation, they wake up in the night with increased heartbeat or choking sensation, a feeling of doom, that I'm just going to die now.
Yeah.
Right? More physically, they're not thinking about what it means to them in their mental space. They always think about it as a physical symptom. So the extreme anxiety. At this point of time, it's important to understand that we have to take care of the sympathetic overdrive. So medications play a big role when they have extreme anxiety. Until they start medication, some of the tips that we can ask them to do is a very known skill known as a TIP skill. So TIP stands for temperature. So like I told you, the sympathetic nervous system is overactive when you're anxious. So we try to activate the other nervous system, which is known as a parasympathetic nervous system. That nervous system calms you down. So you kind of ask people, you can just wash your face with cold water or use a cold water towel on your face. That kind of activates your parasympathetic nervous system and you can calm down temporarily. Another one is intense exercise. So doing some jumping jacks, going for a run. Because when you finish that and you come back, your parasympathetic activity becomes active and it calms you down. Another thing is known as paced breathing. So paced breathing means you breathe in to a count of 3, you hold to a count of 3 and you expire to a count of 6. So basically your expiration is longer than your inspiration. The paced breathing or the temperature is the one that's most practical. Like if I'm really anxious about a presentation, I can't suddenly stand up and do jumping jacks, right? So you can train the patients and the clients to do paced breathing because it helps in reducing the anxiety to a bit. But if it's very significant, then they need anti-anxiety medications.
So, ma'am, coming to another common disorder, which is depression, how do we identify depression in people?
So all of us feel sad, right? And that's why it becomes difficult for us to tell people when they have clinical depression. So I talk about clinical depression. So clinical depression is when you're sad all the time or you have a lack of interest in things that interested you before. It has to be there for a minimum period of 2 weeks consistently. It can't be that I'm just sad because I had a bad day or I've not done well in an exam. It's something which is consistent for more than 2 weeks and it has to be accompanied by your feelings of hopelessness, worthlessness. You have sleep and appetite changes. So either you could be sleeping all the time or you have a decrease in sleep. The same thing with appetite, a lot of emotional eating or lack of appetite. Clouding of thoughts. And these thoughts are usually negative, very self-critical, guilt feelings, lack of energy and drive, suicidal thoughts.
Ma'am, so the symptoms that you mentioned, can these happen to children as well? Like, are the symptoms similar that the children experience as well as the adults?
Yeah, so contrary to what people believe, children also can undergo depression. So depression can be identified in children as young as 6 years of age. Right? Their presentation sometimes is a little different from how it is in an adult. So children with depression usually will be more irritable. They'll cry or throw a tantrum without any reason. They have a lot of phobia to go to school, not want to interact with strangers, refusal to kind of study or refusal to cooperate with the adults at home. Sleep and appetite disturbance is also seen a lot in children.
So, ma'am, can depression be completely cured? Can there be a relapse?
So, depression can be cured, right? Because we know the models of depression are the biological model of depression. We know that our triggers can aggravate a vulnerable person. So, somebody who already has a vulnerability to develop depression, when there are triggers, that's when the depression manifests. So, there are 2 ways of treating that. One is we treat the biological aspects of whatever deficiency we are having with the neurotransmitters. We correct them with the help of medications and we intervene in the help of therapy to take care of their way of thinking, their cognition, what are the triggers that kind of cause them to have an overthinking. So when you combine the 2 together, they can be completely cured. Having said that, there are chances of depression. It's not that you cannot have depression once you've had it once. But if you take proper treatment for the assigned period of time as prescribed by the doctor and the therapist, the chance of relapse become lesser.
Okay. So, ma'am, many professionals also talk about high-functioning anxiety and high-functioning depression. So, can you please tell us more about how we can identify these conditions in real life?
So when you're talking about high-functioning individuals by themselves, so the high achievers always want to portray that they have everything in control. So that the same thing goes across in their depression and anxiety because there is so much of rationalization or putting their symptoms under the carpet, thinking that I have this in control. So when you see high functioning anxiety or depression, it's mostly something that we call as dysthymia, or something that's there. It's a chronic thing. It's present for more than a year or 2 years. It's more like a lack of joy that they experience, or they're not able to function to the best of their abilities. So unlike when you have major depressive disorder, where it's very, very debilitating, they can't function, it causes problem in their socio-occupational functioning. That's when they come for treatment, right? In their social life, in their home life, in their occupation life, high functioning individuals are able to manage these things, but they could do better. So we'll see a lot of high functioning individuals who are not able to take care of their role as parents. They're very irritable, very angry. It's not very obvious. They just think, I'm just being a disciplinarian, or I'm just trying to correct my child. But it's the underlying depression, anxiety which kind of causes the problem. Or at workplace, they don't achieve as much as they could. We have high functioning depression and anxiety patients who shift jobs a lot, like who move jobs, say that they're not satisfied with what they're doing. But because they're high achievers, they don't kind of have a lot of financial problems because of that, but they're unable to stick to a particular job because of lack of focus.
Okay. So, ma'am, what can one do if he or she identifies features of depression or anxiety in themselves? And when should they seek help from a psychologist or a psychiatrist?
So I think that if you're able to identify with all these symptoms that we spoke about, then you must reach out to the nearest mental health professional that you are comfortable with.
Okay.
A lot of times people are not comfortable to reach out to a mental health professional because of the stigma associated with mental health illness. And I think it's time that we break that stigma. I mean, you would go to a doctor if you have chest pain, right? I mean, if I have like a little bit of problem with my vision, I go ahead and wear my specs. So if you're able to break that myth that depression is a physical illness just like diarrhea or just like fever, then I think the stigma is broken, and you can reach out to a psychologist if you know somebody who's good and approach them, and a psychiatrist if medications are needed.
Okay. So thank you so much, ma'am, for taking time out of your busy schedule. I hope this discourse will, help people prioritize their mental health over their illness, and also break some stigmas, as you mentioned. Thank you, ma'am.
Thank you so much for having me, and I hope that people reach out and like how TalkSpace is about talk about mental health. I think this is a great initiative, and the more we get talking about it, I think we'll be able to reach out to more people. So thank you.
Thank you, ma'am.